So today's topic is B complex vitamins. There are three chapters, part 1, part 2, and part 3. Combined them will do in this class. B complex vitamins, page number 344 onwards, those who have the textbook. If you have the new textbook, please mention the page number in the chat box. New textbook 349 is the page number. So the first vitamin B complex is vitamin B1. It's called as thiamine. And its main role is to dismiss the deficiency of beriberi. Okay, vitamin B deficiency, beriberi. There are different types of beriberi. Thiamine is very important in controlling the deficiency of vitamin. The deficiency condition is called beriberi. So functions, essential functions for the release of energy from carbohydrates, vitamin B complex, majority of them, you will see again and again this particular function that pops up again and again. Okay, that is the release of energy or helps in the metabolism of macronutrients. Some vitamin B complexes will help in the breakdown of protein, some will help in the breakdown of fats, some in the release of energy from carbohydrates, that is breaking down carbohydrates into glucose. Okay, you will see this function coming again and again. Also, for the normal functioning of your nervous system, for the health of your nervous system, for the health of your skin. Okay, you will see functions of vitamin B, different types of vitamin B, time and again pointing towards the same function. One is metabolism, nervous system, health of the nervous system, and also the health of your skin. Okay. So here, thiamine is important for your appetite and good health. Okay. Appetite is the feel of having food. Hunger is different from appetite. Okay. You may be hungry, but you do not have the appetite to eat. Okay. Appetite is more psychological in nature. Hunger is physiological. Okay. Hunger is a physiological need. Appetite is a psychological need. Okay. So necessary for appetite and good health, needed for the normal functioning of your nervous system. These are the main functions of vitamin B12. Okay. In detail, other functions are given in the textbook that you can use, read later. Okay. Deficiency of vitamin B12 leads to fatigue, depression, irritability. Irritability because anything goes wrong with the health of your nervous system, you will feel a lot of mood swings. Okay. Beriberi is a disease of the nervous system, and it's very common in countries where the staple food is polished rice, polished white rice. Okay. And also, if you come from a state in India where your staple food is polished white rice, okay, you are also at a higher risk of developing beriberi. Okay. So coming to different types of beriberi, it occurs in areas where main diet is polished rice. Okay. And as mentioned earlier, and there are different types of beriberi: infantile beriberi, adult beriberi. Okay. In infantile beriberi, you will see tachycardia, vomiting, convulsions happening. In adult beriberi, dry skin, irritability, progressive paralysis. Okay. These are the signs and symptoms. Infantile beriberi happens when mother's breast milk is low in vitamin B, and even the child while growing in the mother's stomach. Okay, while she's pregnant, when the mother is also deficient in vitamin B, it leads to infantile beriberi. Then you have Wernicke-Korsakoff syndrome. This is seen in people who are alcoholics, or it only develops in alcoholics because too much of alcoholism or too much of alcohol in your system will decrease the absorption of thymine from your intestine. Okay, and it is usually neuropsychiatric in nature. Okay, a lot of agitated movements. Okay, not having apathy for others, memory loss, aggression, unnecessary aggression, and temper tantrums. These are some neuropsychiatric symptoms seen in alcoholics, which is usually because of the decrease in the absorption of thiamine. They get irritated very fast and they get aggressive on for no reasons at all. Okay, this is very common in alcoholics. Okay, this kind of behavior. It is usually the deficiency of vitamin B1 thiamine that leads to this kind of behavior. So two different types of beriberi, wet beriberi and dry beriberi. So in wet beriberi, there is a lot of edema in your body. We call it wet because there is a lot of water content in the body. And because of which the heart's output, okay, is too much that what a heart can give. The heart has to pump this extra volume of blood because of too much of water in the body. There is extra volume of blood that developed. Now your heart has to physically pump the high volume of blood. So it leads to heart failure, heart hypertrophy. Okay. Heart increases in size, especially the right ventricle. Right ventricle receives the blood. Okay. And it has to pump it into the lungs. Okay. Right ventricle will pump the blood up into the right atrium, and from there it goes into the lungs for oxygenation. So the right side of the heart, especially the right ventricle, that's one chamber of the heart that undergoes hypertrophy, that increases in size. Okay. Tachycardia or bradycardia can happen, either of the one. Too much of heartbeats or too low, less heartbeats. Tachycardia means too much of heartbeats, more than 100 beats per minute. Okay, bradycardia is less than 50 beats per minute. Dyspnea, not able to breathe properly, because when there is an edema, there is a overall body swelling. Water pressure over your lungs will also be high. Okay, so that leads to dyspnea, not able to breathe properly. Edema means swelling in the lower extremities. Oliguria, very less urinary output. Okay, they may urinate, but very less amount of urine comes out of them. Lactic acidosis, the blood's pH is slightly towards the acidic side. Okay, in dry beriberi, you have neuropathy, peripheral neuropathy, muscle weakness, gait ataxia, paresthesias. Paresthesia means not able to, the feeling of numbness. Okay, certain parts of your body, if it has a tingling sensation and you don't feel the sensory function of those areas are not complete, that is paresthesia. Okay. Wernicke's encephalopathy. Encephalopathy is something that wrong happens to your skull. Okay, your cerebral system is affected. Gait ataxia means you are not able to stand properly. Not able to stand properly. Your feet, when you try to bring your feet together to touch each other, you fall down. You don't have the balance. That is gait ataxia. And also with closed eye, they cannot keep their feet together. Okay, they can stand, but when they close their eyes, they are not able to maintain the balance. They fall off. That is gait ataxia. Encephalopathy, as I mentioned, it's a brain disease, developmental disease of your central nervous system. Not just the function, but also the structure of your brain will be affected. And also, if the structure and function of the brain is affected, you will not be in a normal mental state. Okay, so that is Wernicke's encephalopathy. Lactic acid, as I mentioned, the blood becomes slightly acidic in nature. The pH of the blood turns acidic in nature because there is too much of lactic acid present in the blood. Okay. And why lactic acid is present? For example, when you join gym, okay, when you are joining gym and you work out a lot on day one, the second or the third day you feel soreness in your body. Why is this soreness? Because the muscle has built up lactic acid. Okay. And this lactic acid is the cause of the buildup of lactic acid is the cause of soreness, because what happens is that your cells does not have enough oxygen to give you to burn that extra calories. So lactic acid is produced to give that extra calories. The same lactic acid is produced, will be settled into the bloodstream as well when your tissues are not receiving oxygen. Okay, but your tissues and cells yet have to function. They produce lactic acid, and this additional lactic acid will be sent into your bloodstream. So that's what lead to lactic acidosis. So all the signs and symptoms of different types of beriberi, is it clear to all? Infantile beriberi, it occurs usually in infants by the age of 3 to 4 weeks, okay, who are best breastfed by thiamine deficient mothers, as I mentioned. Even during pregnancy, if the mother is deficient in thiamine, and even during after pregnancy, when the child is being breastfed, vitamin B complex and fats are completely dependent on mother's diet. If the mother's diet lacks this vitamin, okay, the breast milk will also be deficient in this vitamin. So what happens in terms of signs and symptoms? There is heart failure seen in children, which may occur suddenly. Aphonia means you see them crying, but they does not have sound. Okay, absence of sound, inability to speak, because either their larynx is damaged, loss of voice when they are trying to be the child is trying to cry, the child is trying to make noise while crying, but you can see the child crying, the facial expression there is, but there is no noise. Okay. And absent deep tendon reflexes. When a child is born, there is a lot of reflexes that is seen in the children, newborn children. With age, these reflexes will fade away. Okay. When you tap, when the doctor uses certain hammer to tap certain parts of the child's body, those areas will reflect. Okay. They will either cause abduction or adduction. Okay. So these reflexes will not be seen in the children. Okay. For example, when you put your finger in the child's palm, a newborn baby's palm, the child will grasp it. Okay. The child will grasp that finger tightly. When you put a small finger in the child's mouth, the child will start to suck the finger. So this is also, these all are reflexes. Okay. When you try to touch the cheek of the child, okay, the child will move towards the direction of your hand. Okay, which side the child is feeling the touch. So these are reflexes that are seen in a newborn baby. Okay, so these reflexes, some of these reflexes will be absent. Okay, so that's the sign of infantile beriberi. So coming to the best sources of thiamine, majority of the B complexes are found in seeds, pulses, cereals, nuts. Okay. So best sources are cereals, pulses, oil seeds, nuts, yeast, meat, fish, egg, milk. For adults, RDA is 1.2 to 1.5 mg a day when you are eating cereals and pulses, especially if you are eating unpolished rice. whole grain, multigrain, whole grain attas are used, you will not be deficient in thiamine. And also, Indian government has made some regulation in controlling the thiamine deficiency in India. For example, polishing the rice should not exceed 5%. Okay, there is different level of rice polishing. Okay, you should not you should not use a polished rice that is polished more than 5%. Avoid excessive milling and polishing of cereal grain. So that is also a control measure taken by Indian government. And if you are cooking rice, okay, when you are boiling rice, boil it in exact water. Make sure you are not straining the rice water away. Okay, boil it in exact water so that all the water used is the rice will soak it up while being cooked. Okay, so there is no water left to throw. Don't use the strain and boil method because you will lose a lot of vitamin B complex in that method. Bread and other cereal food can also be fortified with vitamin B, the breads that you get in India. Okay, and also the atta brand, the specific brand of attas that you buy in India, like Ashirwad and all. So there are lots of elite, different brands are available of wheat flour. Okay, that is, these are also fortified with vitamin B12, vitamin B1. Pistachios are also a very good, pista is a good source of vitamin B1. Cashews as well. Organ meats like meat, pork, liver, eggs, they also are a good source of vitamin B1. Polished rice, when you're eating polished rice, consider it has no thiamine at all. Okay, negligible amount. Polished rice has negligible amount of thiamine. You should strain the water after boiling rice when you are using parboiled rice or the whole rice with its husk. When you are using it, then you can strain the water. But when you are buying the polished rice, do not use this method because you will be losing all the vitamin B complex, which is already low. Okay, in polished rice, whatever is remaining, that also will be lost. When you wash rice, 40% of the thiamine is gone. And when you boil rice in excess of water, and when you discard that water, that kanji water, what you discard, okay, that will also result in loss of thiamine. Okay, so that's the reason why we say if you're using white rice, polished white rice, don't use the kanji method, don't use the straining and the straining the water away method. But if your staple food is parboiled rice, okay, the matta rice, the big round ones, parboiled rice, uh, the while washing the parboiled rice and while discarding the rice water, not much thiamine is lost. Coming to the next vitamin, riboflavin, vitamin B2. It has a yellow colored, it's a yellow colored enzyme, riboflavin. Okay, vitamin G, it's a yellow colored enzyme. It is relatively stable in a heat, acidic, or oxidation kind of an environment. It is stable. It's not reactive, and it is highly soluble in water. The main functions of riboflavin, again, metabolism of carbohydrates, proteins, and fats. Thiamine was involved only in the metabolism of carbohydrates. Riboflavin is involved in the metabolism breakdown of carbohydrates, proteins, and fat. It also leads to growth, repair, and development of body tissues, healthy skin, eyes, and tongue. Okay. And it's also a growth promoting factor, leads to the secretion of growth hormone as well. It has a lot of coenzyme kind of a function. Riboflavin acts as a coenzyme, which means it helps in getting a biochemistry reaction completed. Okay. For example, to release energy from glucose, fats, and amino acid, uh, riboflavin should be present when this conversion is taking place. To convert B6 and folate into their active state of coenzyme and storage forms, riboflavin is required. So these are some main functions of riboflavin. Deficiency, it leads to loss of appetite, swollen tongue, cracked lips, eye infection, dermatitis, and it affects your growth as well. It will suppress the growth if you are deficient in riboflavin. So these are the deficiency signs and symptoms of riboflavin. Glossitis, which means inflammation of tongue. Chiliosis is inflammation of the angular region of your lips and also dryness of the entire lips. Itching and burning of eyes, that is also riboflavin deficiency. Angular stomatitis, chiliosis, glossitis, these all are orolingual manifestation that you are deficient in riboflavin. Sometimes you will have seborrheic dermatitis, not contact dermatitis, seborrheic dermatitis in your forehead, ears, nasolabial groove. That is the area where the nose and the cheeks touch. Okay, that area that you will find dryness there. And riboflavin deficiency is usually seen in low income groups, below poverty line families. In all age groups, all age groups are vulnerable to riboflavin deficiency. If you have a cereal based diet without any pulses, without any milk, okay, that could lead to deficiency. Risk of tuberculosis, infections, malabsorption, hyperthyroidism, and also cancer. Risk of developing these diseases is associated with riboflavin deficiency. It can affect, it can cause respiratory infection as well, put you at the risk of developing respiratory infection. Visual fatigue is an eye symptom. Photophobia, you are not you don't like to such bright rooms or rooms, or you don't want to be in bright rooms. Okay, that is photophobia. Lacrimation means your eyes tear up a lot, wet eyes. Diminished visual acuity, not able to see things properly. So the best sources of riboflavin: yeast, whole grains, dry beans, and pea, green vegetables. These are good sources of riboflavin, along with organ meats, eggs. RDA, you can refer the table in the textbooks to find the RDA for specific age group. But it's around 1.6 to 2. 1.6 to 2 is the normal requirement, microgram per day. Milk products, eggs, liver, green leafy vegetables, These are good sources of riboflavin, all dairy products. Tender leaves and buds of any green leafy vegetables, not the mature ones, the tender ones. They have more riboflavin. Wheat, all of your millets like ragi, jowar, bajra, pulses, they are fair sources, not the best, but fair sources. They have riboflavin. But white rice, especially white rice, is a very poor source of riboflavin. You don't have much riboflavin in white rice. Drumstick leaves are the best source of different forms of vitamin B complexes, not just one. Riboflavin, niacin, vitamin B6, folic acid, pantothenic acid. Okay, a lot of vitamin B complexes is found in drumstick leaves. If you boil your green vegetables or pulses or cereals a lot, that will lead to loss of riboflavin, and especially when you discard this water. Okay, when you boil these vegetables and green leafy vegetables and you discard the water, you are losing a lot of riboflavin. Any food that is cooked in large amount of water, loss of riboflavin is high. Next is niacin, B3. So the oxidation of niacin leads to nicotine. Okay, and when you use niacin, you are able to cure this disease condition called pellagra. We'll see that later. What is pellagra and how does the signs and symptoms of pellagra look like. Okay, and niacinamide or niacin is used in a lot of skincare and cosmetics. It has skin benefits as well, cosmetic benefits as well. All the cells in your body, they require niacin. It plays just like your thiamine and riboflavin we have discussed earlier. It helps your nutrients, macronutrients to break down and release energy. Okay, carbohydrate, fat, protein, and even alcohol to break it down to give you energy. Niacin is also required. Also, it helps in the synthesis of protein and fat in your body, which leads to the formation of your DNA and RNA. So that's the reason why niacin is required to repair your genetic material. Okay, DNA and RNA also undergoes a lot of stress, strain, and damage. Okay, but repairing it is important. So niacin is required for the repair because the proteins required for DNA repair, the fats required for DNA repair can be synthesized in the presence of niacin. It is also included in the NADP pathways. These are coenzyme pathways. It also helps your body make fat and cholesterol to support your system. So these are the main functions of niacin. A lot many biochemistry functions are given in the textbook, but that is not that important. No, you don't have to mug up those pathways or names and conversions. Deficiency of niacin gives these signs and symptoms: fatigue, depression, memory disorder, dementia, loss of appetite, nausea, vomiting, not able to physically be as active, that is underperformance of your skeletal muscles, skeletal system, diarrhea, pellagra, dermatitis. Okay, pellagra is a combination of three Ds: diarrhea, dermatitis, dementia. Okay, when these three Ds come together, which means you have pellagra. Okay, so this is pellagra. The deficiency of niacin causes pellagra. Dermatitis, diarrhea, and dementia. These are the three Ds. Earlier it was dementia. Now there is one more D called depression. Okay. So it was usually seen in people who live in US and they belong to the lower socioeconomic group. And when uh, corn was produced and when corn was considered as a dietary staple, that's when the disease of pellagra started coming up, because there was a lack of corn-based diet. They lack lysine and tryptophan. Okay, so that's the reason why there was an amino acid imbalance in the diet of the citizens of USA who primarily grew corn, that is maize. Okay, so the skin symptoms that you see here, like the dermatitis that you see here on screen, when you expose the skin to sunlight, it will cause more burning, itching. Okay. But you to develop pellagra, diarrhea also has to be present along with this dermatitis and dementia. Right now, instead of dementia, now we call it as the fourth D, that is depression. So if it is untreated, okay, there is loss of weight, uh, not able to do any functions properly on their own, okay, and if it is untreated, it leads to death as well. And usually nowadays, the dementia has been replaced by depression as well. Some say dementia still is present in pellagra along with depression, but in some theories, it is said that depression has substituted dementia in pellagra. But these three Ds are present in pellagra. Signs and symptoms like anorexia, nausea, digestive disturbances, emotional changes like people getting anxious, irritable, not able to sleep. Okay, they all start before you get into the disease of pellagra. And the rashes you see here is photosensitive, means when you're exposed to sun, these become more active. They become more inflamed. And on the neck, when this dermatitis happens on the neck, it is called as Castle's necklace. And this kind of, you can see here this darkening of the same image is given in the textbook as well. The same kind of a darkening around the neck, if it is found, the dry texture, and the same kind of darkening, if it is found around the neck, it means the patient is suffering from pellagra. And this kind of darkening can be found in groin, axillary regions, okay, lower surface of the breast. These can also be affected with the deficiency of niacin. So there are certain drugs that can induce pellagra. If you are on any of these drugs for a long period of time, it can affect the way how you absorb niacin from your intestine. So if any person is on anti-tuberculosis agents, especially isoniazid and pyridoxamine, okay, if these are the drugs you are on since the past 9 months, high chances are of pellagra can happen. If any child or adult is on anti-epileptic drugs, anticonvulsants, okay, that also decreases the absorption of niacin. Chemotherapy drugs and immunosuppressive drugs can also reduce the absorption of niacin. Next, the best sources of niacin: broccoli, peanuts, chicken, mushrooms, bell peppers or capsicum, kidney beans, if you are eating jowar, if jowar is your staple, you can replace jowar with some other cereals, because too much influence of jowar can also reduce the absorption of niacin. Or you can still have jowar, sorghum or jowar with good quality protein. Choose fortified breads which are fortified with niacin. Bioengineered sorghum that has low leucine strain, that can also be good. Including groundnuts in your everyday diet is important. Groundnuts are a good source of niacin, or peanuts, groundnuts. So having a handful of groundnuts is important to cure the deficiency of niacin. They are a good source of thiamine as well, rich in calories, fat, and protein. So giving a handful of groundnuts for children while they're growing is good for their B complex requirements and fats and protein. Next is your chapter 19, water soluble vitamins, part 2 will continue from there. So far, is it clear? Thiamine, riboflavin, and niacin. So next chapter, we'll start with folic acid, folate. Vitamin D deficiency can aggravate your psoriasis. Psoriasis is more like an autoimmune situation. But vitamin B deficiencies can aggravate psoriasis. So folic acid or vitamin B9. So folic acid is kind of a general term which we use for tetraglutamic acid, TGA. And the term folate is we commonly use it to describe any compound or mixture of compounds which have the activity of this PGA. That's what we call as folate. So main functions of folate or folic acid, it helps your cells to grow and multiply for cell differentiation, healthy cell differentiation. Folate is required. Helps to form our red blood cells. Folic acid deficiency would lead to anemia. Helps to form your genetic material. It also helps in the synthesis of proteins and fats that can lead to repair of your DNA and RNA. It balances the levels of homocysteine in your blood. Homocysteine is a protein found in blood. Too much of homocysteine can cause a lot of breakdown in your RBC. Okay. Red blood cells will break down, will be destroyed if there is too much of homocysteine in the blood. Okay. It supports the brain and brain development during pregnancy and also during infancy. So a expecting mother and a lactating mother's diet should not be deficient of folic acid. Okay. One of the reason why folic acid is given as a supplement during pregnancy. Okay. It keeps the healthy functioning of your brain system and nervous system. Okay. Even as an adult, folic acid helps to keep your mood swings at a bay. Okay. Memory, it helps in good memory as well. Just give me 1 minute. So deficiency of folic acid, it causes sensation of weakness, that is tingling and numbness. Okay, kind of a paresthesia. Okay, especially your fingers and toes. You will feel a numbness and tingling sensation there. Ulcers in the mouth, sore tongues, feelings of weakness because there is not enough RBC. Okay. And when a mother is pregnant and if she is deficient in folic acid during her pregnancy, it leads to this neural tube defects. Okay. All these disorders you see here in a newborn baby is a neural tube disorder, spina bifida. Okay. That is the spinal cord protrudes out of the vertebral column. Okay. Kind of a tumor like structure from the spinal cord protrudes out. That is spina bifida. Anencephaly, that is absence of skull. You can see the child is born with an open head. Okay, there is no bone formation over the head. This is anencephaly, absence of skull. Okay, and cleft lip, cleft palate. Okay, these all are the symptoms of neural when the neural tube is not closed properly. When the fetus is developing, neural tube defects leads to these conditions. Okay, folic acid deficiency leads to underdeveloped neural tube. That could become any three of this condition. So folic acid rich sources. Hilsa fish, kingfish, pomfret. Okay, this you see here is a kingfish and pomfret. These are the very best sources of folic acid. Hilsa and pomfret. Hilsa fish is typical in Bengali cuisine, and pomfret is usually used in Maharashtrian cuisine. Soybean is also a good source of folic acid. Bengal gram, sheep liver, quinoa, sesame seeds, black sesame seeds are a good source of folic acid. Drumstick leaves is recommended during pregnancy and also during lactation. Pregnant women have the highest requirement of folic acid dietary folate on a daily basis, and lactating women have the second highest requirement of folate on a daily basis. Why does a folic why may you become deficient in folic acid? Either your diet is very poor in folic acid, you don't consume milk, fresh fruits, vegetables, okay, especially a vegetarian diet, okay. Cooking practices destroys folic acid. Not having proper absorption in your intestine, if you are having anemia, if your diet does not have vitamin C, okay, that could lead to poor absorption of folic acid from the from the intestine. Vitamin B12 deficiency can also lead to folic acid deficiency. Okay. Pregnant women should eat fish. There is nothing wrong with having fish during pregnancy. It's a healthy source of protein, omega-3 fatty acids, folic acid. Too much of suffering from hemodialysis and diarrhea. If there is hookworm infestation, tapeworm infestation, continuous infections going on in your body. That could also lower the absorption of folic acid. If anyone is on anticonvulsant drugs, oral contraceptives, women who are on oral contraceptives, that can also impair folate absorption. Alcoholism also results in low absorption of folic acid. All green leafy vegetables, green leafy vegetables are a rich source of folic acid. Especially drumstick leaves. Drumstick leaves, fenugreek leaves, gogu leaves. Okay, these all leaves are rich source. Methi leaves. Okay, they are also rich sources of folic acid. Next is vitamin B12, cyanocobalamin. Vitamin B12. So functions of vitamin B12, it is necessary for the formation of your RBC, nervous system function, healthy function of your nervous system, prevention of certain forms of anemia like pernicious anemia, any neurological disorders. To prevent that, vitamin B12 is required. And it actually acts as a coenzyme for your metabolism. So vitamin B12 is also required for the breakdown of carbohydrates, fats, and proteins. And if you're deficient in vitamin B12, majority of the vegans and vegetarians, okay? Pernicious anemia is a kind of anemia, nerve degeneration over a period of time. The health of the nerve will deteriorate because of B12 deficiency. So this is how pernicious anemia or a megaloblastic anemia looks like. Normal blood cells, and this is megaloblastic. Mega means big. Okay, the size of this RBC is bigger, but they are immature. They are not mature RBC. Blastic means immature cells. Larger but immature cells. They cannot function properly as an RBC. So this is how pernicious anemia is formed. If the parietal cells, okay, parietal cells are the cells that line your stomach from the inside. Okay, parietal cells are supposed to secrete hydrochloric acid and intrinsic factor. Both are required for iron absorption and B12 absorption. Okay, hydrochloric acid, only in an acidic environment iron absorption can take place. Okay, intrinsic factors are secreted. It's a clothing factor. These factors are secreted by the parietal cells, which helps in vitamin B12 absorption. But because of some reason, if your parietal cells are destroyed, okay, your stomach will not produce enough amount of hydrochloric acid. Your stomach will not produce intrinsic factor. So when there is no hydrochloric acid, you will go into an iron deficiency anemia. And when there is no intrinsic factors, you will go into a B12 deficiency anemia, that is pernicious anemia. Okay, so this is how you develop pernicious anemia. Destruction of the parietal cells, it could be because of ulcers, peptic ulcers, any wound, okay, hyperactivity of hydrochloric acid that has destroyed the cells, any surgeries, okay, medications, certain medications, chemotherapy, okay, these can destroy the parietal cells in your stomach, okay. Too much of acidity can also lower the function of parietal cells. Intrinsic factors, there are different forms of intrinsic factors. It is kind of a glycoprotein. It's a protein which has a glucose bond to it. And its main function is to make sure it can transport vitamin B12. Signs and symptoms of pernicious anemia: weakness, bleeding of gums, jaundice, loss of appetite. Glossitis is also seen in pernicious anemia. Jaundice, you can see here the difference in the color of two hands. So these are the signs and symptoms of pernicious anemia. And causes of this deficiency, first of all, inadequate ingestion, not having vitamin B12 rich food. If you have a vegan diet, strict vegetarian diet, okay, suffer from chronic alcoholism, poverty. There is a lot of religious taboo of don't eat this, don't eat that. Not able to utilize absorb vitamin B12 properly. For example, people who are on metformin. Okay, metformin is an anti-diabetic drug. So people who are on metformin for long term, they can have low serum B12. Then RDA of vitamin B12 should not be more than 2.5 microgram per day, but still it's difficult to maintain 2.5 microgram per day. So best sources of vitamin B12, you can see here, all the non-vegetarian food, all sorts of non-vegetarian food are good sources of vitamin B12. All dairy products are also good sources, not best, but good sources of vitamin B12. Eggs are a really good source, especially the egg yellow, okay, egg yolks. All forms of fish, red meat, lean meat, poultry, prawns. Soy milk, which is fortified, okay. Plant-based milk, if it is fortified with vitamin B12, it's good. Any fermented food, if you use fermented food, even fermented vegetables can give you some sources of vitamin B12, fermented like pickled vegetables. For vegans, people who are vegan or diabetic, they should take vitamin B12 supplementation. Next vitamin is your vitamin B6. Vitamin B6, another name is pyridoxine, that is next chapter. No, fermented idli or dosa batter is not a good source of vitamin B12. Even if it has slight amount of vitamin B12, it is not meeting your daily requirements at all. Okay. Pickled vegetables will have higher, because when you're fermenting the batter, you are cooking it as well. Okay. So with heat, a lot of the whatever, like, yeah, kimchi is a good source. It can be a good source of vitamin B12. Pickled vegetables, when you eat it raw without cooking, it's a good source of vitamin B12. Vitamin B6, another name is pyridoxine. Protein metabolism. functions are mainly protein metabolism, not fat or carbohydrates, only protein metabolism. It is involved in the formation of hemoglobin as well, hormones and other structural proteins, healthy development of your nervous system as well. Deficiency of pyridoxine can lead to tiredness, fatigue, irritability. As mentioned, any impairment in the development of your nervous system will cause mood swings, premenstrual tension, premenstrual syndrome. Infants can suffer from convulsions if there is a deficiency in breast milk. So signs and symptoms of B6 deficiency: sore, glossy tongue, that is glossitis will be there, inflammation, and texture of the tongue would be very smooth, not the grainy texture that you normally have. Cracked and sore lips, skin rashes. Okay, that these are the vitamin B6 deficiency. Even vitamin B6 is used in cosmetics. Vitamin B6 based moisturizers and all are used to address skin issues. It also leads to a type of anemia called sideroblastic anemia. Okay, deficiency of vitamin B6 will lead to sideroblastic anemia, in which if you break down the term, sidero means iron, blastic means immature, and anemia is there is not enough healthy red blood cells. Okay, so in sideroblastic anemia, immature RBCs are carrying iron molecules, too much of iron molecules. Okay, there is a certain level of iron that a RBC can carry. Okay, in immature sideroblastic anemia, a single molecule of RBC, single cell of RBC is carrying too much of iron, but it is dysfunctional. Okay, it is not even allowing iron to do its function, neither RBC itself is doing its function. Okay, this is sideroblastic anemia. So the best sources of vitamin B6, these fishes, hilsa, pomfret, kingfish, and this is a Bombay duck fish. Okay, Bombay duck fish. So these are the fishes which are amazing source of vitamin B6. Apart from the fishes, drumstick leaves, walnuts, pista, sunflower seeds, sesame seeds are also good sources of vitamin B6. Oyster and organ meat are also excellent sources of B6. Various synthesis and metabolism is mentioned in the textbook. You don't have to go through that. Only the basic functions, best sources, and deficiency is more than enough. Frying fishes too long will degrade its protein, but it will not lead to loss of vitamin B, because when you're frying, you're using oil, and vitamin B is a water soluble vitamin, not a fat soluble vitamin. Okay. Why frying the fish is considered unhealthy as compared to boiled or steamed fish? Because the amount of fat used, okay, the amount of additional calories that it gives. Fish already is a good source of fat. You're adding more cooking fat into it. Okay. The protein quality also degrades when you fry it as compared to when you steam or boil it. Then you have pantothenic acid, that is vitamin B5. So that this is also present in all living matter, and pantothenic acid, the main function of it is to produce antibodies for immunity in your body, helps in the production of cortisol, okay, that relieves your stress when you're stressed or anxious. Cortisol helps to calm you down. Production of energy, again, metabolism. In metabolism, pantothenic acid is involved. Formation of acetylcholine and epinephrine. These are hormones produced by your adrenal glands. Symptoms of pantothenic acid deficiency, paresthesia, again, it affects your central nervous system. So there will be a tingling, pricking or numbness sensation, especially in the fingers and toes. Okay. The nerves that are very far away from your central nervous system, that are the tips of your toes, tips of your fingers, there you will feel tingling, numbness or pricking sensation. That's paresthesia. Joint ache, muscle ache, pains, okay, fading of hair color, anemia, immunity is impaired, not having enough antibodies in your system. Headache, depression, insomnia, and fatigue, these are also associated with pantothenic acid deficiency. And best sources is yeast, sunflower seeds, shiitake mushrooms, rice bran, egg yolk. Brown rice is best source of pantothenic acid as compared to other form of rice. Whole wheat as well. Black gram, that is urad dal. Next is biotin. So biotin, it plays an important role in, again, in metabolism, okay, breakdown of proteins, fats, and carbohydrates. Helps the body process glucose. You have glucose, but how will the body use glucose? Okay, help the cell you utilize glucose for energy. Contributes towards healthy nails, skin, and hair. So that's the reason why biotin is found in a lot of cosmetics, health products as well. So biotin deficiency, brittle nails, conjunctivitis, depression, dermatitis, fatigue, hair loss. Extreme deficiency could lead to hallucination, loss of appetite, muscle pain, nausea, neurological symptoms like agitation, okay, tremors, weakness. So this is the signs and symptoms of biotin deficiency. The baby you can see here, the child, this was a child who was suffering from biotin deficiency, and the child was treated just for 15 days with proper controlled biotin dosages. Okay, those who have the textbook, they can see on page number 397, or you can just go to the biotin chapter, you will see within 15 days how the child's skin responded, the child system responded to biotin within 15 days. Okay, all these rashes and everything vanished in figure B. Figure B is given in your textbook. Okay, figure A, what I have shown here is the same figure they have used in the textbook as well, but the treated version of the child, when all these rashes has been gone, the swelling had faded. Okay, that version is shown in the textbook. You can see that what difference biotin treatment had brought within just 15 days. Okay. So for adult, just 25 microgram per day. And if the woman is lactating, there is an increased requirement by 30 microgram per day. Okay. Teenagers will require much less, 15 to 25 microgram per day is enough. The best sources of biotin is egg, paneer, khoya, all nuts and seeds, button mushroom, yellow capsicum, all your milk products and egg yolk, cereals and nuts, and also the bacteria, specific bacteria found in your colon, in your large intestine, they also produce biotin, okay, as a byproduct. No, and also remember, not all hair loss or not all skin problems is just because of biotin deficiency. Okay. Hair loss could be because of vitamin D deficiency as well, iron deficiency as well. Okay. So you have to understand, you have to do a blood serum test to understand what deficiency you are suffering from. Okay. Punnangani is kind of a leaf. It's kind of a leaf used in southern India. It's a green leafy vegetable. You can consider it, you can cook it in the same way. So consider doing a blood serum analysis to understand what vitamin deficiency you're suffering from and accordingly correct those deficiencies and you will see a reduction in hair loss or skin issues. Now, this is an assignment for everyone. The B complex vitamins we have discussed just now, just make a table of it. Okay, all the B complex vitamins with their other name. Okay, you have vitamin B, B1, B2, like that, B3. It has its other names as well, like thiamine, riboflavin, niacin. Okay, with both the names, what are the major deficiencies they bring? Okay, how do you diagnose it, treat it, and the best sources? Best sources I have not mentioned here. First, best sources, only the best sources, 5 best sources, vegetarian and non-vegetarian. Okay, 5 best sources of both, make it into a table, one single table, and submit it. Okay, you can make a handmade table on a page, on a paper as well. Take a clear pic of it and you can WhatsApp me as well. Okay, this table, this assignment will be useful for you when you are sitting to study vitamin B complexes for exam. Okay, these are the key areas from where questions can come. The different vitamin B complexes, their other name, major deficiencies, how do you diagnose it, how do you treat it, like the treatment is given in every page. I have not touched a treatment because it's clinical. Okay, and also the main thing is best sources, vegetarian and non-vegetarian, you have to mention. Is it clear to all regarding the assignment?